1.5 years ago, my grandmother was diagnosed with pulmonary fibrosis, also known as IPF. Before she came to me with this diagnosis, I had no idea what pulmonary fibrosis was. Can anybody in this room tell me what pulmonary fibrosis is? Please raise your hand. Yeah, not a lot of people are aware of what pulmonary fibrosis is. So, according to Boehringer Ingelheim, idiopathic pulmonary fibrosis, also known as IPF, affects approximately 3 million people worldwide. The disease primarily affects patients over the age of 50 years old and is more the men over women. This right here is a photo of my grandmother, who sadly was diagnosed with the pulmonary fibrosis lung disease. So I would like to go over 3 main points about pulmonary fibrosis, so by the end of this speech, you will be more acknowledged and aware of what the lung disease is. So it would consist of cause and risk factors, symptoms and diagnosis, and treatment and management. Cause and risk factors. According to Mayo Clinic, pulmonary fibrosis is scarring and thickening of the tissue around and between the air sacs called alveoli in the lungs. These changes make it harder for oxygen to pass into the bloodstream. Damage to the lungs is what causes pulmonary fibrosis. So, exposure to chemicals and such things can be the risk factors, but 4 main risk factors that cause pulmonary fibrosis is smoking, occupational exposure, cancer treatments, and genetics, such as cancer that's passed through generations. Symptoms and diagnosis. Some symptoms of pulmonary fibrosis can include shortness of breath, dry coughs, extreme tiredness, weight loss, aching muscles and joints, and the rounding of the fingers and toes, which is also called clubbing. According to the Mayo Clinic again, doctors use a high-resolution computed tomography scan, or HRCT scan, is an X-ray that it provides sharper and more detailed pictures than a standard chest X-ray, and is an important component of diagnosis PF. A doctor may also perform an echocardiogram, also known as echo. My grandmother, when she was going through the symptoms, she mainly had shortness of breath, coughing, and aching joints and muscles. Dry cough was a huge problem with her, and it was one of the biggest concerns that we had, that we pushed her to go to the doctor to get a diagnosis. She went through the echo to confirm that she had gotten pulmonary fibrosis. Treatment and management. The FDA has approved 2 treatments for IPF. I'll be using abbreviations. The first is Ofev and the second is Esbriet. These medications are called antifibrotic agents. This means that, shown in clinical trials, they have slowed down the rate of fibrosis and scarring in the lungs. These medications have been used in moderate, mild, and severe IPF. The management in some cases, for example, can get very severe. They will use mechanical ventilations in the hospitals, which is a tube that is guided all the way to your lungs to help you breathe. Healthcare professionals will also look for antibiotics or other medications when the symptoms do get more severe. In summary, now that we have went over the key main points that I wanted to go over, which were cause and risk factors, symptoms and diagnosis, and treatment and management, I hope that with this knowledge, you can raise awareness and help yourself and others to make early detection and management, which can improve quality of life for those affected, such as my grandmother. Thank you.